Well, hello and good morning, everybody. Welcome to Bay Area Focus. I'm Roberta Gonzalez. Today, boy, we have a loaded show for you. We're going to hear from two book authors, and we're also going to hear about the year-round work of the Center for Asian American Media, as well as their annual film festival. But first, on deck, my first guest, the executive director from Breathe, California, Dr. Tanya Stevenson, president and CEO. She's here to tell us about a number of things that Breathe, California does for our own area. Plus, we're going to talk about the 25th annual Bike for Breath charity ride. It's all to support the incredible work of Breathe, California, and all the opportunities to help year-round. So let's welcome Tanya here. It is such a pleasure to meet you.
Pleasure to meet you as well.
I'm not sure if a lot of our audience knows really what Breathe California is and how advantageous it is for our community and how we can all tap into this one organization.
Sure. Yeah, we're a lung and environmental health nonprofit. We were founded in 1908 right here in San Francisco. And we are working to fight lung disease, advocate for clean air, and promote public health. So we're doing things like helping people quit smoking. Smoking rates have gone down significantly, but we still have a lot of work to do. So we're trying to help folks manage that. We help people manage their asthma. We help parents learn how to understand and manage their children's asthma. We work on advocacy policy issues at the local and at the state level. And we're working on environmental health with youth. We're going to partner with Girls Incorporated of Contra Costa County this summer to work on a youth environmental education program.
Boy, you have a huge agenda.
Yes.
I was so unaware of that. What I was aware, though, is how I stumbled upon Breathe California. I had just moved here to the Bay Area back in 1996, and I had only lived here a couple of weeks. I went home from work, and I was living in the San Rafael area at that time, and I walked in the door, and I saw my one-year-old child, and he was laboring for breath where his actual stomach was concaving, and I can see his ribs. So I rushed him to Marin Hospital, and they actually put him in one of those ventilators, and they said he had RSV. It's this respiratory virus that's airborne, and you catch it, and they said it was a 50-50 chance of survival rates. So he was in the hospital close to a week. I slept in that bed with him for close to a week, and he survived it. But after that, he had severe asthma, and they said he would have that for the rest of his life. So I looked at Breathe California, and I tapped into your resources and your knowledge in order to help my son live a very healthy life. And today, well, he just turned 21 years old last week, and he is asthma-free. And it was all simple things, advice that I received from Breathe California, like things like just remove the wood from your fireplace in your home, remove the carpet from your home because of all those particulates that get caught in the carpet matter. And I owe my life really to your services, and I want to really share that story with you and thank you for all you do.
Absolutely.
And it's things like that that I don't think people around our community know that you are there for them.
We are. All of our programs are offered free to the community, and we work in San Francisco County, San Mateo County, Contra Costa. We're working with universities, we're working with other nonprofit organizations, local departments of public health. We're working with any community partner that wants to help us in our mission.
So if somebody just says, okay, I'm waking up in the morning, I want to quit smoking, they can just pick up the phone and call you and say, help?
Yes, they can, actually. And what's great is that San Francisco and San Mateo counties are some of the few counties left that actually provide smoking cessation programs free of charge to their residents. So we have an ash kickers program.
A what?
Ash kickers.
One more time.
Program.
Can we see that on TV?
Ash kickers.
Okay.
Smoking cessation program. We're offering it right now, especially in San Mateo County. Their tobacco prevention program has worked really hard to make sure that anybody who works, lives, or goes to school in San Mateo County can has access to smoking cessation programming. And we're doing that throughout the county in both English and in Spanish. And we've been really successful. We are very, very fortunate to have.
Can you go into the schools and help teenagers with this? Because we know that is a problem in our schools as well, right?
Absolutely, it is. Especially now that the youth are turning to e-cigarettes more than they are to the traditional combustible cigarettes. But we are working with San Francisco Unified School District as an example, and going in and offering tobacco awareness programming as well as quit groups for kids who are smoking but they really want to quit. So
I want to ask you, what is your favorite program? What is the one program, because you have so many, an umbrella of many different resources. What do you like to do that you find great pleasure in?
You know, it's so hard to choose. I don't know. I have talked with participants in every one of our programs, and right now I think, you know, the story that stands out for me the most is our asthma education program for parents. And in talking to a woman who had to quit her job because her son was always in the hospital, she was terrified she wouldn't go to sleep at night because she was afraid that he was going to have an asthma attack.
Yes.
She was in and out of the hospital with him
Right.
for 2 years. She didn't know what to do, and she came to our program. She learned how to understand, manage his asthma.
Right.
And he didn't go back to the hospital. But more than that, and I think this was what I love the most about this program, is that it helped her understand how to communicate with her physician, and her son's physician, so that she knew what to ask, what to say, and it helped to keep her son out of the hospital.
That sounds like my story as well. That is just really great to hear. Also, we didn't get a huge opportunity to talk about your annual bike ride, but I've been riding in this for at least 15 years or more. It's my way of giving back to Breathe California, and I form a KPIX cycling team, and we ride up and down the peninsula, and there's several different distances, and if anybody wants more information on that, we can always go to your website to find that. But it is a wonderfully supported bike ride. It's beautiful around the peninsula, and we raise money for all your different programs.
Yes, and there's 3 routes. There's a family-friendly route that's only 10 miles. There's a 30-mile route.
Right.
And there's a 64-mile route, which I think is the one that you
That's my ride, and I got to tell you, we want to thank Tanya for being here today. Thank you so much. And if you want more information about Bike for Breath or one of the many programs that are available to you for free here in the Bay Area, all you have to do is log on to ggbreath.org. Again, that's ggbreath.org. Coming up, the Center for Asian American Media talking about their upcoming film festival and all the work they do all year round. Stay with us. We'll be right back.